How do new technologies measure bladder residual volume? How do new technologies measure bladder residual volume? This is an important question, especially for those managing bladder health or bladder cancer. Recent advancements have made it easier and more accurate to assess how much urine remains in the bladder after voiding, known as post-void residual volume. Let's explore these innovations. One of the most exciting developments is the use of ultrasound-based wearable devices. These flexible devices can be worn on the lower abdomen and continuously monitor bladder volume. They work by sending and receiving sound waves that bounce off the bladder. The device then calculates the bladder volume based on the time and intensity of these echoes. This method is non-invasive and allows for real-time monitoring, which is especially beneficial for patients with bladder dysfunction or those undergoing treatment for bladder cancer. Studies suggest that these devices can achieve mean relative errors of around 11 to 15%, making them quite accurate. Another common tool is the portable ultrasound bladder scanner. This handheld device is placed on the abdomen after a person has voided. It captures images of the bladder and uses software to calculate the volume based on the bladder's shape and size. This method is quick, non-invasive, and widely accepted in clinical practice, particularly for assessing bladder health in cancer follow-up. Artificial intelligence is also playing a significant role in improving bladder volume measurements. AI and deep learning algorithms can analyze ultrasound images to identify the bladder region and calculate its volume more accurately. This technology reduces the variability that can occur with different operators and provides real-time measurements, enhancing diagnostic accuracy for conditions like urinary retention and neurogenic bladder dysfunction. Additionally, advanced ultrasound techniques, such as shear wave elastography, assess bladder wall elasticity. These methods provide valuable information about bladder pressure and muscle activity. While they are not yet used for continuous monitoring, they offer complementary data for evaluating bladder health. In practical terms, continuous wearable ultrasound devices are great for real-time monitoring, especially for patients needing frequent assessments. Portable ultrasound scanners remain the standard for quick measurements in clinical settings. The integration of artificial intelligence not only improves accuracy but also makes these assessments more accessible. However, there are some considerations. Proper device placement is crucial to avoid inaccurate readings, and there is currently a lack of standardized protocols for some advanced techniques. In summary, new technologies for measuring bladder residual volume primarily relying on non-invasive ultrasound methods, enhanced by wearable designs and artificial intelligence. These innovations provide accurate, continuous monitoring that supports effective bladder health management and care for bladder cancer patients. Always consult healthcare professionals for personalized advice and information regarding bladder health.